Part 2, Nicotine Addiction. To be honest, nearly all smokers need help of some kind because quitting starves you of nicotine. There are lots of products available called NRT, nicotine replacement therapy. They supply nicotine to the body and receptors, which significantly reduces cravings. Nicotine is the main ingredient and therefore much less dangerous because there is no arsenic or tar, cyanide, carbon monoxide, polonium, methanol, titanium, or any of the other unhealthy toxic chemicals found in cigarettes. The clean, safe nicotine is delivered in an alternative way, which is far less addictive. Here are descriptions of the main products. Patches come in a selection of brands and designs. There are 3 strengths. Step 1, high. Step 2, medium. Step 3, low. Start on step 1 and then step down gradually so you slowly wean yourself off and shut down the receptors. It takes around 11 weeks on average. Some medical experts recommend always starting with a step 1 patch, although manufacturers give guidelines based on how many cigarettes a day you smoke. For instance, the guidelines might say use a step 2 patch if you smoke less than 10 a day. It's not an exact science because every smoker responds differently, so it's impossible to predict what will happen to you. If you do start on step 2 and it works, great, carry on. But if it's not doing it for you, then move up to step 1. As long as there are no side effects, it's okay to continue, at least for the first couple of weeks to give you a forceful kickstart. Every morning, cut the sachet and remove the patch. You need to take the backing off. Sometimes there's 2 flaps, this only has 1. Carefully take it off, being careful not to touch the sticky surface. Hold it by the edge. Place it on the upper arm, run your finger around the edge, then hold on with the palm for 20 seconds. This makes it stick. Patches have different designs. Some are like this one, like plasters. Others are clear and they come in all shapes and sizes. All of them work in exactly the same way. They continuously drip feed nicotine through the skin. Ba-boom, ba-boom, ba-boom. It goes through the skin and into the bloodstream, then around the body and up to the receptors. A bit of irritation and itching is quite normal for a few minutes, but it wears off. If it goes on for 2 hours or more, or is painful, it might be the glue, so swap to another brand. Take the patch off at bedtime, although if you normally wake up in the night to smoke, or are absolutely desperate for a cigarette when your eyes open in the morning, then you can use 24-hour patches to stop those things happening. Beware though, patches worn while asleep can give you funny dreams. If you are pregnant, remove the patch before going to bed. A new patch should go on a different place every morning. You can return to the original place after 7 days. By the way, you obviously need to adjust these timings if you have another sleep pattern because of your lifestyle or shift work. Patches are great and are very popular because you put one on at the start of your day, then forget all about it. The steady drip feed keeps the nicotine at a constant level, so the receptors are happy and the urge to smoke is much, much lower. All NRT products release nicotine into the bloodstream through the lining of the mouth. It then goes up to the receptors and gives them a blast. Oral medications have a whole range of makes, doses and flavours, and a whole range of reactions from users. I'll show you some reactions. Oh, it's not too bad for a medicine. Or, that's vile, absolutely disgusting, I'm going to spit it out. Or, doesn't seem to taste of anything. Or, that's a peculiar taste, but it is taking the craving away. Or, I like that, nice one, yes. I see roughly an even number of each reaction. It's the luck of the draw. Here are points you need to know about each one. Firstly, chewing gum. Chew slowly. When a strong flavour comes through, stop chewing and park it at the side of your mouth. Then start chewing again. Chew each piece for up to 30 minutes. If you're pregnant, do not have licorice gum. The inhalator has a nicotine cartridge inside. This is very good for the hand-to-mouth action. Draw vapour into the mouth. Do not inhale and take it down. Mouth sprays can take some getting used to, but are worth persevering with because it's fast acting and effective. Practice by spraying in the air. You want a mist, not a thin jet of liquid. Lozenges and mini lozenges do not swallow or chew. Put it on your tongue and suck until it's dissolved. One called microtab you put under the tongue. One that does not go in the mouth is the nasal spray. It's quite strong, very beneficial for heavy and dependent smokers. NRT products can be bought in shops, supermarkets, pharmacies and online. Decide which is the right make, product, dose and flavour for you. Look at the information on display packs or on the internet. Whichever product is used, take the whole course. It's much more effective to carry on for longer than finish early. Always read the patient information leaflets thoroughly. Although NRT can be bought over the counter, they are medicines with contraindications and side effects. So, please take care and use as directed. Especially keep the medicine away from children. They are not sweets. Don't be caught out by forgetting to put your patch on or take your medication. Keep an emergency supply in your bag or car, case, desk, workplace or locker. If you live in the UK, NRT is normally available on prescription from a doctor, smoking advisor, pharmacist or nurse. They can also give you advice. E-cigarettes have been improved over the years and vaping is now commonplace. The current consensus among UK medical professionals and scientists is that vaping is much healthier than smoking. It's because the nicotine is inhaled through vapour rather than smoke, and e-cigarettes contain substantially fewer harmful chemicals than regular cigarettes. Vaping may not be completely safe, but is considerably safer than smoking tobacco. Buy a quality e-cigarette from a trusted retailer. Ask them to help ensure you get the correct nicotine content. There are various doses between 0, none at all, up to 20 milligrams. Steadily reduce the dose over time. The flavoured versions are interesting. There are hundreds to choose from. Vaping works. By supplying nicotine via a hand-to-mouth action means that e-cigarettes can provide invaluable assistance when stopping smoking. An alternative medication to NRT is varenicline, a prescription drug branded as Champix in the UK and other countries and Chantix in America. The drug is indicated for adults over 18 who are not pregnant. Champix contains absolutely no nicotine. How it works is quite complex. Briefly, it blocks the action of nicotine in the brain, making cigarettes taste strange and unpleasant. But the main way it works is very clever. it can feel as though Champix goes to the receptors, finds the control, turns it off and sends them to sleep. Cravings and withdrawal symptoms disappear. The manufacturers recommend you complete the 12-week course of treatment, starting with the 0.5 mg white tablets in the first week, followed by the 1 mg blue tablets twice a day for 11 weeks. The Champix leaflet instructs you to smoke for the first week and set a quit date in the second week. That is definitely spot on for some people, but quit dates vary. I've had patients feeling nothing until it kicks in during the 3rd or 4th weeks, and I've had the opposite. Others saying in the first week, around day 5, "Oh, the cigarettes taste funny, I just don't want one," and they quit there and then. As with all pharmaceutical medicines on prescription, there are potential side effects, although not everyone gets them. Common ones are nausea, sleep problems, headaches and colds. Usually these are tolerable and fade after a few weeks. Nausea can be alleviated by taking the tablets with food. Always report side effects to your prescriber, but if they become really bad or unbearable, do not take another tablet and speak with a doctor or specialist as soon as possible. Champix is only available on prescription from a doctor, pharmacist, nurse or stop smoking advisor. If you develop an interest in Champix and it becomes your #1 choice, I strongly advise making an appointment with a healthcare professional who has a good knowledge of the drug. Have a comprehensive, serious consultation with them about all the information and your suitability. Cold turkey is using no aids or medication at all, just strength of character. A small proportion of smokers do succeed and they stay quit with cold turkey. They just make up their mind and go for it. It's a tough challenge, a great trick if you can do it, and eventually the nicotine addiction goes away. The cutting down method employs a gradual reduction of cigarettes. For example, a 20 a day smoker reducing by 1 a day over 3 weeks. In practice, it rarely works, and stop smoking specialists will generally encourage use of another method. It can help though with going cold turkey or using NRT or Champix by cutting down for the few days before stopping completely. There are a number of therapies used to help smokers. All of them have their supporters. Well-known therapies include acupuncture, hypnotherapy, NLP, that's neuro-linguistic programming, meditation, homeopathy, herbal supplements, mindfulness and CBT, that's cognitive behavioural therapy. Conclusive proof of their effectiveness is sometimes lacking. Even so, thousands of smokers have successfully quit using these techniques. You might too. There are plenty of books on the market that give advice, tips and information on quitting. The best-selling book is Alan Carr's Easy Way to Stop Smoking. It can be useful for anyone not using medication. The internet is full of stop smoking websites. The level of presenting and the quality of information fluctuates hugely. Click around. It could inspire you or at least provide useful ideas to supplement this film. As a starter, try NHS Choices, Pinterest, Quitter Circle, Positive Thinking Stop Smoking Images, or just search Stop Smoking. If you are going to use an advisor for support, face-to-face is preferable, but it doesn't suit everyone or may be impossible logistically. You just can't get to the appointments. There are superb alternatives. Telephone helplines, social media, texts, online chats and emails. Some organisations offer these services free of charge, organisations such as the NHS, Quit and Stoptober. Do a bit of research to find the one for you. Apps. Check out apps too, especially the ones offering daily encouragement. If you like apps, this could be your way to a new life. Now it's decision time.
Tell us which one is the best.
Well, every person and smoker is unique, so you won't be surprised to hear different methods work for different people. Our task right now is to find the best one for you. Tell me this, while you were listening to the descriptions, was there one specific method that caught your attention and jumped out as being right for you? If that happened, go and try it. I'm a big believer that instinctive gut feeling directs you to the best solution. If you would like advice, I'll give you my opinion. Based on years of experience working with thousands of smokers, these are my recommendations. Try going cold turkey. No medication, just sheer single-minded determination and willpower. To make it a lot easier, use ideas from part 1 on psychology and part 3 on habits, and also get some tips from Alan Carr's book. Next, consider Champix, but remember my strong statement. If you think Champix is for you, go and speak with a knowledgeable healthcare professional. If both cold turkey and Champix are unsuitable, then nicotine replacement therapy is probably the way to go. For the majority of people, I find going down the NRT route produces the highest success rate, and lots of scientific evidence backs that up. Before you ask, the crucial question is, which NRT product should you use? The answer comes from extensive research that shows this: using 2 NRT products at the same time delivers the best results. It's called combination therapy. Many patients of mine have had great success using a mix of products. Use a patch as a base to give you that constant drip feed supply of nicotine. In addition, use an oral product, a gum, inhalator, mouth spray, lozenges, microtab or nasal spray. You probably find you are drawn to just 1 or 2 of them. If not, pick one at random. My patients tend to favour mini mints, although any of them do the job. You can also use an e-cigarette as an additional secondary product. Yes, that's right. A patch together with an e-cigarette is absolutely fine. Combination therapy is effective because the patch keeps the nicotine level steady and the secondary product combats the unexpected craving spike that sometimes occur. A lot of would-be quitters fall off the wagon when an intense urge suddenly hits them and they cave in. There is no need to light up. Chew a gum, use a spray, have a vape, pop a mint, whatever you like. The receptors are blasted, the urge fades away. In a few minutes the crisis is over and you are still a non-smoker. If the cravings come frequently, then take the medication frequently too. 10 minutes before it usually strikes. That will prevent the sudden craving. Examples of combination therapy. For a 10 to 20 a day smoker, use a patch plus a low dose 2 mg lozenge or gum or inhalator or mouth spray or 8 mg e-cigarette. If you smoke over 20 a day, you definitely need a step 1 patch. You could also increase the dose of the secondary product, a 4 mg gum or lozenge, or extra mouth sprays, or more use of the inhalator, or step up to a 16 mg e-cigarette. Some combinations could have a third product too. You might use the patch plus a gum and a mouth spray, then alternate between those two. If you want to carry on with the hand to mouth action, the third one could be an inhalator or an e-cigarette. If patches don't agree with you, try combining other products, for example a lozenge and a mouth spray and an inhalator. An extreme heavy smoker on 60 a day could combine a 25 mg patch with a nasal spray and a 20 mg e-cigarette. You may need to experiment with various products and doses before finding the perfect combination for you. Using 2 or 3 products is safe, but do not have a cigarette as well. Smoking at the same time as using combination therapy means you could overdose and end up in hospital with nicotine poisoning. It ain't pleasant. What is pleasant is the relief that you finally have your addiction under control. Combination therapy could be the answer. Let's review where we are. You have a strong psychological base with a list of reasons to quit, high confidence and willpower, plus a choice of strategies to stop nicotine drug addiction. Now we can deal with the third and final piece of the jigsaw: habits.